"Doctor, am I still a man?" That's what George, 67, asked me during a quiet moment in my office. He wasn't joking. He wasn't angry. He looked lost. His voice cracked and his eyes welled up as he whispered, "I don't wake up hard anymore. I can't feel the urge. My wife says it's okay, but I know it's not normal." If you're a man over 60, you've probably felt that same fear, quietly wondering what's happening to your body, your desire, and your manhood. Let me be clear. You are not broken. You are not weak. And you are not alone. As a urologist with 30 years of experience, I've seen this story play out thousands of times. And every time it starts with confusion, then shame, then silence. But today I want to break that silence. Because the truth is this. What's happening to your manhood after 60 isn't just about erections. It's not just about testosterone. And it's not your fault. This video will walk you through everything I wish every man over 60 knew. Why testosterone naturally drops, and when it becomes a medical issue. Why erections become less reliable, and what that really means about your heart and brain. Why orgasm, desire, and pleasure still matter, even if they feel different now. And what you can start doing today to feel like yourself again, without shame, pills, or pressure. Because here's the truth most men don't hear. Your manhood isn't disappearing. It's just asking you to listen differently. So if you've ever asked yourself, "What's wrong with me?" or "Why don't I feel like a man anymore?" this video is for you. Leave your questions in the comments, like and share this video if it helps you. And let's begin this journey together. Testosterone, why it drops and what's really happening to you. Let's start with a truth that many men never hear. Your testosterone began to decline long before you turned 60. In fact, most men start losing testosterone gradually after the age of 30, around 1% per year. By the time you hit 60, you could be down 30 to 40% compared to your prime. But here's the twist. It doesn't hit all at once. It creeps in, slowly, quietly, until one day you realize you're no longer waking up with energy, drive, or desire. You're not weak. You're not failing. You're experiencing something that happens to nearly every man, but few talk about. And it's not just about sex. Low testosterone or hypogonadism affects almost every part of your health. Fatigue that doesn't go away with rest. Mood changes, irritability, sadness, or even depression. Loss of muscle mass even when you stay active. Slower metabolism and sudden belly fat. Poor focus and brain fog. And yes, lower libido and weaker erections. But most men ignore these signs. Why? Because we've been told they're just part of getting older. And that's where the damage begins. One of my patients, let's call him Michael, was a former marathon runner. Sharp-minded, strong, always leading the room. He came to me at 62 and said, "Doc, I feel like someone turned the light off inside me. I'm not just tired. I feel invisible." I ran his labs. His testosterone was 217. The normal range for men is 300 to 1000. He wasn't just aging. He was drowning silently. And I want you to hear this carefully. That man used to radiate strength. Now his hands tremble when undressing, not from cold but from shame. That shame is not yours to carry. Let's make this simple. So, what's normal and what's not? Some testosterone decline is normal with age. You might not feel the same fire you did at 25, and that's okay. But when that decline affects your daily life, relationships, and health, it's not just aging. It's a medical condition. You wouldn't ignore high blood pressure, right? Then don't ignore this either. The real question isn't, am I too old? It's, am I living below the level of health I deserve? Should you get tested? If you're over 60 and noticing the following, get your testosterone checked. Low energy that doesn't improve with sleep. Loss of interest in sex for weeks or months. Trouble concentrating, remembering, or staying motivated. Increased belly fat despite eating well. Depression or loss of confidence. Fewer or no morning erections. A simple blood test, done in the early morning, can reveal your total and free testosterone levels. But here's the key. Don't diagnose yourself with Google. And don't let shame stop you from asking your doctor. Too many men suffer in silence, thinking it's just their fault. I'm here to tell you it's not. And yes, there are options. Some are natural, like sleep, resistance training, and losing fat. Others involve medical therapy, like testosterone replacement, but that's a conversation to have with a urologist who actually understands your goals. Because we don't treat numbers. We treat men. And you, sir, are still a man, no matter what your labs say. The only question is, are you ready to reclaim your energy, your focus, and your fire? In the next section, we'll talk about the part of your manhood that scares most men the most, erections. Why they fade, what they mean, and how to get control back, naturally, safely, and confidently. Erectile dysfunction. It's not just about getting hard. Let's be honest. The word erection makes most men uncomfortable, especially when it stops working. But here's the truth that many doctors don't explain well. Erections are not just about sex. They're about circulation, hormones, nerves, and confidence. Your penis is not a simple on-off switch. It's a complex, sensitive barometer of your overall health. So when it starts to change, gets softer, takes longer, disappears, it's not just a sexual issue. It's your body trying to tell you something. Let's break it down. What actually controls an erection? To get and maintain an erection, four systems in your body must work together. Your brain. Desire begins in your mind. If you're stressed, depressed, or distracted, your brain can't send the right signals to your body. Your hormones. Testosterone triggers desire, arousal, and the ability to maintain a firm erection. Your nerves. Your spine, pelvis, and penile nerves must carry the brain's signal to your blood vessels. Your blood vessels. Your arteries must expand and pump blood quickly into the penis. Your veins must close off to trap that blood in place. Just one of those systems fails. No erection. And unfortunately, as you age, each of those systems becomes more vulnerable. Blood vessels stiffen. Nerve sensitivity drops. Testosterone declines. Stress and sleep issues increase. And here's the thing most men don't realize. ED is often the first sign of deeper health problems, like heart disease or type 2 diabetes. In fact, many cardiologists say, if a man can't get hard, we should check his heart before we check his pants. I had a patient named Tom, 64, who came in thinking he had performance anxiety. He was embarrassed, felt broken. I ran some labs and a vascular ultrasound. Turns out, he had 80% blockage in his iliac arteries. He didn't need pills. He needed a cardiologist. Temporary versus chronic ED. What's the difference? It's normal for erections to fluctuate, even in young men. Temporary ED can be caused by stress, poor sleep, alcohol or medication, performance anxiety, arguments with your partner. This kind of ED usually goes away when the trigger resolves. But chronic ED, when you struggle to get or maintain an erection more than 50% of the time over several months, is a medical issue. It's not just in your head. And it doesn't mean you're too old. It means your systems aren't working together, and they need help. And yes, I said help. Not judgment. Not shame. Not silence. Because the truth is, I once thought I was broken. Until my urologist said, your penis isn't failing, it's just asking to be heard. That single sentence changed Tom's life. He started walking 20 minutes a day, eating better, cutting sugar. Within 3 months, his blood flow improved, and so did his erections. What can you do right now? Let's get practical. Before you try any pills, consider these first steps, backed by science. Exercise. Especially walking, squats, and resistance training. They increase blood flow and boost testosterone. Sleep. Aim for 7 to 8 hours per night. Your body makes testosterone while you sleep. Manage blood sugar. Diabetes damages the nerves and vessels that control erections. Cutting sugar and processed carbs helps more than you think. Limit alcohol. 1 or 2 drinks are okay. More than that reduces testosterone and dulls nerve signals. Address stress. Try deep breathing, meditation, or counseling. Chronic stress raises cortisol and blocks sexual desire. Reconnect emotionally. Many men report improved intimacy when they feel emotionally safe and connected to their partner. You don't have to do all of this overnight. But every step you take matters. Because ED isn't just about performance. It's about identity. It's about connection. It's about feeling like yourself again. And that feeling, that spark, is still there. Sometimes you just need the right tools to reignite it. In the next section, we'll explore something even more sensitive: desire and orgasm. What happens when you don't feel like it anymore? Is that normal? And how do you rediscover pleasure after 60? Let's talk about that next. Desire, erection, orgasm. Everything changes, but nothing disappears. Let's talk about something that rarely gets discussed, especially among men over 60. Not the erection. Not the testosterone. But desire. That spark. That inner fire. That feeling that you want to be touched, or to touch. I've had men tell me, "Doc, I think my desire's gone. Maybe I'm just too old." And I always ask them, when was the last time you listened to what your body needs, not what it used to be? Because here's what I've learned after 30 years in urology. Desire doesn't disappear. It simply evolves. Your body changes, your hormones shift, your stressors multiply. And all of those things affect your sexual response. But none of that means your intimacy is gone. It just means it's asking you to connect in a different way. What really happens to desire after 60? Yes, your testosterone is lower. Yes, your erections may take longer. Yes, your response might be slower, more subtle. But the emotional part of desire? The need to feel close, wanted, needed, connected? That doesn't vanish. In fact, for many men it becomes stronger. You may not have the urge the way you did at 25. But you have something deeper now: experience, presence, intention. The problem is, we've never been taught how to listen to that. Men are taught to perform, not to feel. And when performance slips, we assume desire is dead. But the truth is, most men don't lose desire. They simply forget how to love their own body. That's not your fault. It's how we were raised. It's how society defined manhood. But now, at this stage of your life, you get to rewrite that script. Erection versus pleasure. They're not the same. Another thing no one tells you? You don't need a perfect erection to feel pleasure. You don't even need penetration to experience intimacy or orgasm. Your body is still capable of arousal, connection, release. It just works a little differently now. Here's what might change after 60. Erections may take longer to build, and may not stay as firm. You may need more direct stimulation to become aroused. The path to orgasm may feel slower or less intense, but also more emotional. The refractory period, time between erections, gets longer, sometimes days instead of hours. This is normal. This is human. And when men stop chasing performance and start exploring sensation, emotion, and connection, many find sex becomes more meaningful than ever before. One of my patients, Rick, age 70, told me this after counseling. "Doc, I used to count orgasms. Now I count eye contact." That's what happens when we let go of old definitions and embrace new ones. Orgasm after 60, still real, still powerful. Can you still orgasm after 60? Yes. Can it feel different? Also yes. Your prostate, pelvic floor, and nerve response all shift with age. You may ejaculate less volume or none at all. You may feel the climax build slower or more emotionally. But orgasm is not just a physical release. It's a full body, full heart experience. And that experience never expires. Want to know where you stand? Try this simple test. I often give my patients a quick desire check-in. Not a medical exam, but a reflection tool. Answer these 5 questions honestly. Do you still fantasize or imagine sexual moments, even occasionally? Do you enjoy touch, even outside of intercourse? Do you miss emotional closeness or physical intimacy? Do you feel curious about pleasure even if it feels different now? If your body could talk, what would it ask for? If you answered yes to at least 3, your desire is still alive. It's just waiting to be heard, not judged. Because desire isn't about youth. It's about attention, curiosity, permission. And yes, it's about giving yourself permission to be human, not perfect. So what can you do today? Here are a few ways to reconnect with your desire and pleasure. Slow down. Don't rush intimacy. Focus on sensation, not goal. Talk to your partner. Share your fears, your hopes, your curiosity. Many partners are more open than you think. Explore non-sexual touch. Hand-holding, massage, cuddling, these rebuild trust and safety. Strengthen your pelvic floor. Try Kegel exercises daily. They improve sensitivity and control. Stay present. Use breath, sound, eye contact. Intimacy starts in awareness. And above all, stay kind to yourself. Aging isn't losing. It's refining. And desire isn't gone. It's just become quieter, waiting for you to listen again. In the next part of this video, we'll tie everything together. What do all these changes mean for you as a man? And what steps can you take to protect and embrace your manhood, starting now? Let's finish this journey together. Conclusion: you're not losing your manhood. You're learning to understand it. Let me say this clearly one last time. You are not broken. You are not failing. You are not less of a man. You are changing. And change does not mean weakness. It means evolution. Yes, your testosterone is lower. Yes, your erections may not be the same. Yes, your desire might feel more quiet, more emotional, more complicated. But none of that takes away your manhood. In fact, it gives you a chance to deepen it. I've been a urologist for over 30 years. I've spoken with thousands of men who thought they were finished. And what I've learned is this. The strongest men aren't the ones with perfect performance. They're the ones who stay curious, honest, and kind to themselves. So here's my advice, from doctor to man. Get your testosterone checked. Not because you're broken, but because you deserve answers. Pay attention to your erections. Not to judge, but to understand your blood flow and stress. Reconnect with your body, not like it used to be, but like it is today. Talk to your partner, not with shame, but with truth. Move your body. Sleep deeply. Eat with care. Touch with presence. And above all, stop comparing yourself to the past version of you. That man was great. But this man, the one who's still here, still trying, still listening, is just as worthy. So I leave you with one question. When was the last time you truly listened to your body, not with fear but with respect? Because your body is speaking. Your manhood is speaking. And it's not asking to be perfect. It's asking to be heard. If this video helped you, share it with a man you care about. Leave a comment, your question, your story, your truth. And subscribe for more. Because you're not alone. And this journey is just beginning.